I'm very pleased to give the floor to Dr. Nedret Emiroglu, which is the director of the program management of the regional WHO. And as the director of the Division of Health Emergencies and Communicable Diseases, she leads the efforts to support the member states to prepare for the implementation of the international health regulations. She has a very long experience in emergencies, and I'm very pleased that she's here to give her opening remarks. Thank you.
Thank you very much, Chair, and ladies and gentlemen, dear participants from all member states, partners. It's a really great honor for me to welcome you here in this very important meeting, another milestone for the European region. And let me start by thanking Germany, the government of Germany, to kindly hosting the meeting, but also making the financial means to WHO to be able to arrange that. And my very dear friend Dagmar Reitenbach, thank you so much for hosting this important meeting in this beautiful city. And I hope you will have a bit of time from working to get around. We are in the center of this beautiful city with a lot of, I understand, celebrations going on, so just try to take your time. This is not the first. We are trying as the WHO regional office to make this an annual event, and as some of you would remember, and I see a lot of familiar faces from our meeting in St. Petersburg, at that point kindly hosted by the Russian Federation. And we have reviewed our progress, achievements, challenges, and the way forward. So almost a year had passed, and many things have been happening since then. On the global front, unfortunately, the emergencies, either infectious origin or due to humanitarian crisis, are unfortunately increasing. There are more and more people in need of our support, our collective support as WHO, together with the partners, including the other UN agencies, but most importantly with you, the member states. And in this aspect, we have been working at the global level on a new 5-year strategic action plan, which is setting the global priorities for health. And that's called the 13th General Program of Work, which is under discussion with the member states, and it will cover a 5-year period from 2019 onwards. And it has 3 big pillars one is the 2 sides of the same coin. In one way, it is looking into the saving people's lives and protecting people from emergencies on the one side. On the other side is having universal access to health, universal health care, as a means of being able to protect the lives in case something happens. And that's exactly in line with the European region's priorities. So you will see that since we have established the WHO Health Emergencies Program also in the European region, we have been working extremely closely with the 3 levels, both at the global, regional, and the countries, but at the same time integrating the other multi-components from other aspects, linking the emergency preparedness together with the health systems and the public health functions. And you will hear more about that in tomorrow, which is a breakthrough also in the European region that we have to ensure, as was seen in the Ebola outbreak, to be able to respond in an emergency with a strong, resilient health system. And our efforts has been also continuing on collecting the information and experience from the countries, member states, to be able to share those best practices, but at the same time to provide direct support to certain countries who need more of the external assistance. In that aspect, we have identified the priority countries. We have been working together very strongly with some of you, going through the various exercises to test also our capacities in case an health emergency happens, and you will hear more about these as well. And of course, this could not have been done without a strong partnership, either in the preparedness part or in the response section. We have been working very closely with all the UN agencies, but also with the European Commission and institutions, particularly with the ECDC, and also the institutions like World Bank, Asian Development Bank, and the European Development Bank. All our efforts are to save people from any health threats. And I'm looking forward to this meeting with another milestone to bring us one step further to build the capacities that is needed to detect any threats on time, to do a proper risk assessment, and to define on the response needed and take the efficient response in a very timely manner. Of course, that requires also looking into other aspects of health threat, which we have brought in this meeting, the AMR as another component that we have to take into account, but also the importance of multi-sectorial work, which we need to reach out to other sectors who require our collective action in order to be prepared and respond. So it's a heavy agenda, but I, as Ute mentioned, I'm sure you will enjoy it. We will learn from each other. We definitely want to listen to you, particularly in our plans in the region to strengthen WHO's efforts to build the capacities, which is going to set us as strategic pathways for the next 5 years. And we would like you to give us feedback on how you want to work with us together, which will be very important. So I'm really looking forward to it. Thanks once more for coming to join us, and wishing us all a successful meeting. Thank you.